night I couldn't sleep.
And I think for people that have heard my name or seen kind of Brain MD versus Amen Clinics versus Amen University, there's a lot of confusion because my role has changed over the course of several years. So I'm excited that we're going to be able to talk about that. And just, I work for Brain MD and Amen University, but I help Amen Clinics and our outreach team, which is one of the most important things that we do, getting people resources before, during, and after they come to see us. And then just how I was in the Amen Clinics as a clinician for 7 years. So really, really excited to just kind of talk through that more with people and hopefully get some clarity.
Absolutely. And I am so excited to do this because I truly feel that you have such an understanding of everything that happens at the Amen Clinics and at the full clinic level, and also what happens with our brain health coaches, which is such an important piece of what I do. So I'm so happy to be here. Would you want me to just kind of run through kind of the evaluation process, and let me chat a little bit about what I do, and then we can talk about how you and I work together almost obsessively on a daily basis. Okay, so I am one of the clinic outreach managers for Amen Clinics. We have 8 clinics across the country, and there are multiple clinical outreach managers. I am honored to work primarily with our Orange County clinic, but I work with all of the clinics around the country. So I work primarily and partner with outside therapists, physicians, psychiatrists, psychologists, helping them line out care and resources for their patients in the clinics. So often what that looks like is a psychologist or therapist will reach out to me and say, hey, Katie, I have this client. They've been working really hard on getting better. I gave them a diagnosis based on their symptoms. The diagnosis makes complete sense based on their symptoms. Their psychiatrist has recommended medications for their diagnosis, which makes complete sense, and they're not getting any better. So what I will do is work with them, help them set up a full evaluation process at the clinic level. And what that looks like is when the patient books, that we send them about 20 pages of intake paperwork. We're going over biological, psychological, social, and spiritual factors, but we're also looking at a brain systems checklist. So what we've discovered over the 30 years plus of research that we've done is that the way that people answer questions will actually point us to areas in their brain. And that's a big part of also the brain health coaching certification course, as you well know. All of that paperwork is filled out and sent back and reviewed by a patient outcome manager, a role you also know very, very well. Yeah. Right. How long were you a patient outcome manager?
7 years.
7 years. Remarkable, right?
Yeah. Because from its birth, from just doing histories to more outreach and making sure that we have all the information that we need from their current care team, and then kind of hand-holding them with the referrals, which is why you're so important, because once people know about what we do, let alone come to see us, they don't want to see or talk to anyone again unless we know them and we love and trust them. So
1,000%. And that's what I always say to people too, is that intake with the patient outcome manager, the paperwork that they send back, when they sit down and they meet with them for the first time, they're not telling the story again for the millionth time.
Yeah.
Because also too, I don't know if you've noticed this, but I've noticed that when I talk to patients, they will omit things, super important things, because they feel that their experience is so much that they've learned to take certain things out, and we don't want them doing that. And the patient outcome manager's role is so vital in like caretaking that super vulnerable place that the person comes in at. So that's why I love working also with patient outcome managers. Then we have them, after that history appointment is done, they go off to do their first of 2 scans. I always love somebody to get 2 scans, one while they're resting, one while they're concentrating. Then they do the neurocognitive assessments online, all of which culminates to a appointment for 2 hours with a physician, where they go over all of that information again. Here's the information from your therapist, your psychiatrist, your family members, the patient outcome manager, and here's your brain and how all of that fits in. And this is a better or more appropriate plan for your brain type. And that's where the brain health coaches come in, because this is usually the point in the process where the doctors are asking me, hey, Katie, do you know of anybody who does this super unique style of therapy or integrative blood work in this area where we don't have a clinic? And what I always say is, let me check my list. And my list is always a group of people that meets that criteria. So if it's appropriate, if this person is a therapist, awesome. If they are also a brain health coach, that's who I want to partner with, because the patients that we work with, as you know, they've seen on average 3 to 4 providers, they've been on 3 to 4 medications that have failed, and they're desperate. So whoever we refer them to, they see as a continuum of our care. And that's another way that you and I collaborate together, is we're so protective of our patients that we would much rather refer them to somebody who is a therapist and a brain health coach, because we know when we send the patient along with the paperwork, they're going to take good care of them. And that's why you and I have become so professionally obsessed with each other and work together every single day.
I know. And it's so weird because when I was doing coaching just as a coach, I didn't want to be a therapist. I don't even have a master's degree, but so much of my coaching was holding them accountable to their therapy with their therapist. So there's a lot of cool things that we can do to kind of just share care. And I think that's one of the things that people don't really realize too, is it really does take a village. It takes a team. We're used to going to our primary care doctor and they refer us to 4 different specialists for 4 different parts of our body. Why can't we look at that in a bigger picture, the most important picture, looking at our brain that controls everything going on in our life, to that same idea, which, you know, we've talked about that a million times. Like, we start at the top and work our way down.
Yeah, I love that. I love it. And so I'm super curious, what is the most helpful thing about our relationship? The relationship between you as the super duper coach and overseer of all things brain health coaching, and your relationship with the clinic outreach managers and the clinics.
So when we do have coaches that are interested in their own process, which I think is the most powerful thing, I wouldn't be in this job. God knows if I'd even be here if it wasn't for all the information I learned from our doctors. They really saved my life. So it's really important to kind of just keep that in mind. But then also when the coaches have referrals, they have a client that they want to partner care with, I can handhold them to make sure that all of those little details that you kind of don't think about in the anxiety of getting your brain scanned, like getting that person's, you know, getting that referring therapist on the consent form when you walk in the door and are about to get your brain scanned, and making sure that your therapist is as involved, or your doctor, naturopath, holistic healer, energy healer, shaman, whoever it is that referred you, and his brain health coach, because we have it all over the medical, non-medical grid as far as those types of people. How involved do you want them in your care? Because they can be as involved as you want them to be. And then once you walk out the door, which isn't literal anymore because it's on Zoom, but once you are done with that Zoom appointment with a physician where you just got all of the answers to questions you've had for however many years and a treatment plan, making sure that that referring provider is involved and they get everything that you get. They get the scans next to a healthy normal for your age and sex. They get the evaluation, they get the cognitive testing, they have everything that you have, so that you're starting already way down the line than you would if someone just kind of walked in your door and said, I'm depressed. You know everything about that person. And people used to joke with me when I was giving history, like, you know more about me than my husband. And I'm like, well, that's my job, is to like ask you all of these questions that nobody's asked you before, starting with, how is your parents' attitude toward their pregnancy with you? That can turn into a 30-minute conversation with needing a referral to a trauma therapist. Like, so many things that we do, not just with a scan, because we can never look at a scan and tell you everything that's going on with you, even though it's very helpful and it does show 5 to 10 years before bothersome symptoms. If you do say that your life has been absolute bliss, kitten sunshine and rainbows and unicorns, we can prevent future problems. But I don't think any of us on earth in the human experience have that, but we see people in a vulnerable state and sometimes they do say that. So it's just good to bring it back to the big picture, which is why I wanted to talk to you today about it, just so people understand how extensive our process is. It's so extensive, and there's no evaluation process like what we do with the SPECT, but then all of these other things that we do to get the best possible information, the best possible diagnosis, and the best possible treatment plan, which most of the time is holistic and doesn't involve medications. But if it does involve medications, you're not going to look at that pill and be scared, what's going to happen when I take this pill, which I think most people should feel that before they take a pill. Like especially if you read the side effects on the commercials that they seem to put out every day and think is totally normal, you need to know that when you are about to start a new medication, we know exactly why you need that medication for your brain type. We know exactly why you need that medication based on your genetics and your methylation, all of those things, so that you don't have to guess. No one should be guessing at how they're going to make your life better. Whether it's a doctor, a therapist, a friend, a romantic partner, whoever it is supposed to bring you peace and forward thinking of, I'm going to have a better life starting today because I have this information.
Yeah, absolutely. I love that. And you speak so eloquently about it. And, you're so right. No one should guess, and people should be cautious, right? Not should, but, we can be cautious and question. And I think that that's what we help people do too, is feel okay questioning, because we're as curious. We want to know why. I often say that we're medical detectives, and maybe we're just a little bit obsessive and quite curious, because we're always like, why? Why is that happening? Why is that happening? Why is that happening? Why did that happen? And as a result of asking all of those questions and doing the imaging and the deep dive into things, we can get to the why things are happening. And also we can help people get to their bigger why, which is something that we talk about a lot, is that we want people focused on their bigger why in life. And it's never just the scan. I actually, before I did this, I worked in neurofeedback. I've always been a self-proclaimed neuro nerd. I don't know why. The brain just kind of makes sense to me. I think that it's great. But I would hear, it's like, oh, well, if you just do a scan, but that's not all that we do, right? We would never make an assessment or a diagnosis based on the scan alone. It's all of those other elements together in that full evaluation process that gives us that full 360 view of the patient. And then it's the follow-up, right? It's like, we don't really stop bugging our clients for what, a year? Is it a year?
Yeah.
How long is the follow-up?
Hard 6 months, but then with collaboration, I say to people a year, just to get them to understand that this is a process. And when we're trying to heal you on multiple layers of health, it's not going to happen overnight. Maybe physically you'll start to feel better in 2 weeks, but we got to work on this other stuff too. We got to work on the psychological health, the spiritual health, social health. I can't tell you how many people come in that are coming in for stress, and a lot of their stress is in their relationships, and they don't know how to say no, and they need a therapist to teach them about boundaries.
Yeah, absolutely. And the follow-up, yeah, like how you said, it's a hard 6 months.
Yeah.
It's a whole process. And I always love setting the expectation too, that, we are probably not the last stop. We're probably not the second to the last stop. We might be the third to the last stop, but we're the place where you can get the map that you've been looking for this whole time and get some direction. And we do so much at Amen Clinics, right? I mean, we do integrative medicine, we do hyperbarics, we do neurofeedback, we have EMDR therapists, we have coaching, we have memory. But what we don't have, we don't have a sleep study session, or a sleep study. What's the word I'm looking
Just like
for?
a machine.
Yeah, like we don't have a bed where people can come and do sleep studies. But sometimes we find that people have sleep apnea, and we have to recommend that they go and do, the whole sleep test. So it's really, really good to have that integrative approach. And it's so good to work with our coaches, and our coaches are amazing and super interesting. And we really do I call on coaches for so many different things. So I've had, college counselors, massage therapists who keep finding that they're becoming people's therapists during the middle of their sessions. They're like, I need to be able to refer them to somebody, and psychiatrists and psychologists. So talk more about the group of brain health coaches that you have and you work with.
Well, just a reminder to everybody that hasn't ever looked at the course or our referral network. I mean, we have people all over the world. I just remembered I need to text somebody back from the Philippines from this morning. So that's something to think about. And it's all different backgrounds. I mean, I have a guy that really understands our work, and he's a chemical engineer. Like, what does he have to do with brain health? He wants to have a good brain. He wants his employees to have a good brain. He uses our protocols to educate people, because at the end of the day, if you go to like a normal corporate health, whatever, they're just going to moderate your symptoms and give you assessments like, oh, your weight is down, like, oh, your glucose is down. That is fantastic. Diabetes and obesity are a huge, huge problem and responsible for a lot of atypical mental health symptoms, but that's not all that we need to be tracking.
Right.
To be measuring the important stuff like your vitamin D, which is a neurohormone, which having low vitamin D is extremely common, but why? Why can't you just ask your doctor to do a $25 blood test?
Right.
If having depression, especially if you're having depression with suicidal thoughts, if you're having pain, if you're having fatigue, those are all common symptoms of vitamin D deficiency. And you just take a little pill. We have them in a 5,000 IU. I take 2 of them just to be extra safe because it's one of the most important things of your immune system. For some people, even more important than vitamin C, depending on how you metabolize that stuff. These are things that we need to measure. And anyone, a chemical engineer, a mom, a teacher, a psychologist, whoever you are, whatever your background, these are things that you need to learn because you're a human on this planet like the rest of us. We want to have the best experience that we can have. And when it's very simple things that are very simple to measure and very simple to treat, why don't we do it?
Yeah, absolutely. Yeah, it's so obvious, right? I mean, how Dr. Amen says it all the time. How do we know? Like, how do we know unless we look? And it's pretty simple to look, right?
Yeah, that's so funny. That reminds me of something I was going to say earlier. So when I was doing intakes, especially in like the 5th or 6th year after, I'd read, hundreds of treatment plans by that time, met with hundreds of patients and, getting kind of cocky. I was like, oh, I wonder if I know what this person's brain's going to look like. Yeah. And the part is I was wrong a lot. I could that I know what their limbic system is going to look like. I can think I know what their parietal lobes are going to look like because they were having trouble finding words in the session with me. But a lot of times I was wrong. And that's awesome because that's why they're here. We need to really see what's going on. Even someone that's really well educated about brain systems and functional medicine, I was wrong probably half of the time. So it's just really, it was like a fun game I played with myself. And every Friday in our POM staff meeting, we would kind of just talk about the different cases. And it was always me like, I really thought this person was going to have this going on and it's not, it's this, like, it's just so cool. Like, it's just important information.
Right. 1,000%. And that's right in line with what Dr. Amen says, is that right now we're still doing psychiatry the way that it was done when Abraham Lincoln was diagnosed with depression, like shooting darts in the dark. And I love that you share that because you are so well versed and you know a brain. Like if any girl knows a brain, it's you. And to hear you admit like, yeah, I was still wrong 50% of the time, even with all of this information, which is why imaging is so important. Like I say this often, it's like, I really like my dentist. She's not drilling on my face until she takes an X-ray, right? She's a super talented gal and she looks at my teeth. So I think that that's the moral of the story is we look, we're curious with you. There's a lot of moving parts. There's a lot of collaboration. There's a lot of partnership that happens in the clinics, out of the clinics, with our coaches, with our referring partners, with our outbound referring partners, so people that we refer to. And you said it very well. It really does take a village, and we want to be part of that village. It means the world to us.
There's something else to say. So with coaches, because there are holistic health coaches, there are life coaches, there are executive coaches, all kinds of other coaches I can't even think of right now. But when they're a certified brain health coach, it completely changes the game. And I have this conversation with our new coaches all the time. Because as soon as someone signs up for the brain health coaching course, I call them and say, hey, I'm your mentor. If you have questions, let me know. This is my cell, this is my email, whatever. And they'll be like, well, what is your journey like? I'm like, well, I'm kind of the worst person to ask because I'm spoiled. Like I work for the company. I got certified with the company. I've seen thousands of treatment plans. My story is much different than yours. But what I can tell you is if you're an ADD coach, which I'm an ADD coach, but if I was trying to coach somebody not from a brain health perspective, and I was trying to coach them on being a better listener so that they're not missing very important things that their spouse is telling them, and I don't know what their brain looks like, and I don't know their vitamin D and their magnesium and ferritin and testosterone and thyroid, all of those things that are common deficiencies of ADD, how can I ethically feel like a good coach if I'm coaching someone that, in essence, why would you tell someone to run a 5K if they have a broken ankle?
Right.
It doesn't make sense. This Just throwing that out there because it gets me very heated. 'Cause I get people blowing me up on LinkedIn like, oh, do you want to do coaching with us? Do you want to get certified with us? I'm like, no, like I have all the information I could possibly need. I have the best network in the world with the most educated people. You need to get on our train.
There you go.
I'm good.
There you go. And we really do, right? I mean, and you mentioned something earlier that I think is super important about the involvement with our coaches. Of course, I primarily work with your coaches, the coaches that are also therapists, psychologists, psychiatrists, because those are the people who most often work with the clinic. But getting on the train actually means sometimes literally having that brain health coach slash therapist in the evaluation with their patient, on the Zoom with their patient. So yeah, getting on, this is the best train. I mean, I know that we are kind of biased, but it's the best train. So
yeah. You've been working with a patient for 5 years and their depression is not really getting better. And you've given them all of these cognitive skills. You've even done subconscious work with hypnotherapy and they're still having blocks. That's when you need to come with us, and you need to come with us. You need to be with that patient when they see their scan and realize why they're struggling. There's so many brain disorders that don't respond to CBT. They don't respond to DBT. They don't respond to a lot of things that in traditional psychology, and there are articles saying that they are very helpful for certain types of people, but they're not those brain people that we're seeing. I can't tell you how many times I'd read a treatment plan of a little munchkin, which my favorite clients were the kids for ADD, and they had ring of fire, which means that their entire brain is lit up like a Christmas tree. The worst for them to ever go near in their life, not just after their brain has calmed down, is a stimulant medication. So you think about that. And the psychiatrist would say, I don't even want you thinking about therapy for 6 months. Like this brain is so overactive. There's no possible way they can do cognitive behavioral work. We need to calm their brain down with the supplements. We need to optimize their labs because their zinc, vitamin D, magnesium, ferritin are all over the place. Then we can start doing cognitive work and it's going to work in 12 weeks. CBT is supposed to last 12 weeks.
Yeah, I love it. And I love that your philosophy is to not have them, I don't know how to say that, not having them like plugged into us forever and ever and ever. It's to really help them get to a solution and get on their path.
That's what being a parent's, right? You mean, you would know, you're a parent, I'm not. You're supposed to get 18. I think 25 is reasonable because that's when the brain doesn't even start developing. So they can be a functioning adult and procreate their own successful children. It's not a forever job, it's a forever relationship, but your job, there's a goal.
Yep, absolutely. Well, my friend, I think that you and I know we could literally forever. I don't know if the whole Facebook brain health community wants to hear us talk forever, but
I mean, I'm surprised we haven't made it to 30 minutes. I am very glad with everything that we shared.
Oh, say that again. I only heard the very last part.
I'm glad that we haven't hit 30 minutes yet. I wasn't sure.
Okay, good. Well, what do you think? Does anybody need a follow-up or an action item, do you think, in your community of amazing coaches?
I would just definitely make sure they know this video exists. It's going to be on the Brain MD YouTube page, the Brain MD Facebook page, and of course our personal pages, which is basically all AIM related anyway. So you can show it to people if they want to know more about the process, not in the traditional way. Our website is amazing. I am so impressed with everything on there. And for someone that needs to know absolutely every detail about what we do, that's the best way. If they want it more in a story format, just kind of loosely discussing it, especially if they have been the type of patient that has seen multiple providers and like they're wondering if this is too good to be true and they want to hear it from a real person, go for it. I mean, I've had 5 scans. Like I said earlier, I don't even know if I'd be in this job or on this planet if it wasn't for this company and all the loving support that they've given me and my brain that was in really bad shape when I got my scan.
Well, we are all so lucky that has been your journey. How blessed we are to have had you be on that journey, right?
Yeah. And I mean, I could have gone the traditional route, which now just gives me massive anxiety to even think about applying for a general psych or anything related to that, because I always had this feeling and I just always felt like we were missing a big piece of the brain, had no idea why, changed my college 13 times. And it's just always kind of been there in the back of my mind. And I found the front desk job on Craigslist almost 8 years ago. My anniversary is next week. It's like, this is it. This is the answer to every question I've had.
That's remarkable. That's remarkable. Well, we are all so lucky and so grateful that that was your journey and that you took it. So thank you, seriously, for everything that you do. You're remarkable.
You too. You manage so many important relationships. I don't know how you do it, and I'm just super appreciative.
Thank you, friend. Well, I could not do it, truly, and I mean this. This is not just for camera. Like, I literally could not do it without your support. Couldn't.
Well, I'm so glad that I'm able to help everybody. Our outreach team is the most important. It's just so important. And we're about to have a bigger outreach team, which is super exciting. So I thought it was really funny. I found that out right before this and I was like, awesome. This is like perfectly God's timing, me giving a shout out to the clinic outreach team, and our team is getting bigger and we need to be everywhere.
Yeah, I have to say, like, take over worldwide.
Yeah. Worldwide. Thank you so much, Katie.
Welcome, sweetie. We'll talk soon, okay?
Okay.